Today we are going to talk about a topic that affects millions of people worldwide: menstrual health. If you've ever had questions about your period, how to manage the discomfort that comes with it, and everything just period related, then this video is for you. Hi fam, welcome and welcome back to my channel. If you are seeing my face for the first time, I am Dr. Ovusa. Please subscribe to my channel if you want to see more health content like this, and this video is definitely going to be informative, so give it a thumbs up and also leave a comment in the comment section and share this video to somebody that might need it. Every female around you, even males, everybody needs to know about it because there is some stigma or shame around this topic, so much awareness is not being made about this topic. That's why you have to share this video to as many people as you can, so that awareness can be made and we can reduce the stigma around this topic. First, what is menstruation? Menstruation is a natural and healthy process that happens as part of the menstrual cycle in females, and it starts from puberty, which is menarche, that is the age at which the first period is noticed, up to menopause, which is the end of period in females. So that is what menstruation is basically. It is the body's way of shedding the lining of the uterus, which many of us know as the womb. So it is the body's way of shedding the lining of the uterus when pregnancy does not occur, because in preparation for pregnancy every month there are changes that take place in the lining of the uterus, the endometrium, to prepare for pregnancy. So when this pregnancy does not occur, the lining is shed off. So that is what happens in menstruation. The menstrual cycle is more than just the days that you see your period. There is more to it than what you just see. There are actually 4 phases of the menstrual cycle. We have the menstrual phase, the follicular phase, the ovulation phase, and the luteal phase. So what is the menstrual phase? The menstrual phase is what we commonly know as the period. That's the menstrual phase. It begins on day 1 when the period starts, and that happens because the uterus is shedding its lining, so it has to flow out of the body. So that is what flows out of the body that we see, and this usually lasts for 2 to 7 days, but it can vary from individual to individual because as our faces are different, so are we all different. So it cannot be the same for everybody. It varies, but the range is usually from 2 days to 7 days. So that brings me to something that I will just quickly mention. You must have heard of something called LMP, last menstrual period. Okay, I'm just going to explain the concept to you because I've seen a lot of misunderstanding about what this thing is. Sometimes when we ask these questions, some people do not really know. Your last menstrual period is the first day of the last time that you saw your period. It is not when it ended. It is the first day that you noticed it. That is what is taken as the last menstrual period. Especially when we ask pregnant women during their antenatal care and we're trying to calculate their EDD and all of that. When we ask their last menstrual period, some tell us that okay, this is when it ended, but no, that's wrong. It is the first day when it started. That is the day that you noticed it. That is what is the last menstrual period, and it's important for you to always know this date, because anytime you go to the hospital as a female, you'll be asked, because it helps to know if there is possible pregnancy. Then if you are pregnant, it helps to calculate the expected date of delivery. Also, the cycle length. Some people do not know what cycle length is. Cycle length is it starts from the day that you start seeing your period. That is the day 1 of your cycle, and it ends on the day before your next period, and that is different from the period itself, which is the days that you actually bleed for, which has a range of 2 to 7 days. The range for cycle length is 21 to 35 days. As far as it is regular, any day within that range is normal, because we are different, so it cannot all be the same. People used to think that this is the 28 days because that is the hypothetical figure that we use every time when we talk about period, but it cannot be 28 days for everybody. It has a range, which is 21 to 35 days. And now we have the follicular phase, which also starts from the first day of your menstrual cycle and even extends beyond the period. So even after the period ends, the follicular phase goes on. During the follicular phase, your pituitary gland, which is responsible for production of follicle stimulating hormone, which is responsible for, just as the name goes, for stimulating your follicles to release an egg. Okay, that's what happens. So one of these follicles eventually matures and prepares for ovulation. That is what the follicular phase is about. So prepare the follicles, make it mature, ready for ovulation. That will now lead us to the ovulation phase, which is after the follicular phase. Because after this ovary has been matured, it has to be released, right? Yes, that now brings us to the ovulation phase. Ovulation phase typically occurs mid-cycle, that is in the middle of the cycle, and it is day 14 in a typical 28-day cycle. But remember that I said before that everyone cannot have a 28-day cycle, so it is 14 days before your next period. But you cannot know your next period until you have it, so you cannot count it. So it's usually it's something like what we call retrospective diagnosis. So it is when your next period has happened, that you know that, okay, if my period started today, then I must have ovulated 14 days earlier. So that is what happens. But if your cycle is regular, maybe it comes every 30 days, or it has a range, you can know the range at which the ovulation occurs, and you can know that, okay, this is the fertile window. So it is this period that the body releases an egg from the ovary. That is that matured follicle we talked about. Yes, it now gets released from the ovary, and this is the period where the woman is most fertile and she can get pregnant if this egg is fertilized. So the egg travels down the fallopian tube, where it may or may not get fertilized. So that now brings us to what happens next, the luteal phase. So after ovulation has occurred, the body produces more progesterone, which is known as the pregnancy hormone that helps to maintain pregnancy. You must have heard of it, or if you have not heard of it, that is the hormone that helps to maintain pregnancy. So the body releases more of that hormone in preparation for a fertilized egg, because the body expects that the egg must have been fertilized, so the body is preparing for this baby. But then fertilization fails to occur, pregnancy fails to happen. So what happens when fertilization does not take place? The level of this hormone drops, and then the lining of the uterus starts shedding, and then that is the end of that cycle. The next phase starts again. So it just recurs. After the luteal phase, you go into the menstrual phase again, and then you go to follicular phase, go to ovulation, you go to luteal phase. It just keeps repeating itself every month. So these 4 phases happen in one menstrual cycle in 1 month. Knowing these phases helps women to understand their cycles, understand their bodies, track their patterns, and to see if there's any deviation or any change, and report to their doctor so that any abnormality can be caught on time. And I just want to quickly clarify something, because some people have that misconception that a period is supposed to come at a particular time every month, like maybe at the end of the month. That is not so, because it is not like a salary thing. It is a time-based thing. So if your period comes like the 5th of this month and you count 28 days, if it is a 28-day cycle, it will give you about that range in the next month. But if another person starts the period by say 25th of that month, and it also has like maybe a 29-day cycle, it will still give you about that period. So it is not like everybody has it on the 1st, on the 2nd, or third. It is based on when the period starts and the cycle length. That's what determines the next period. So you can be able to monitor and track your period by yourself, by even using a physical calendar. If your period comes this month, you circle the time which it came, and you circle it the next month, and circle it for like 3-4 months. Then you'll be able to get a range, because we always ask these questions and people don't know. So I'm going to tell you now that you should always take note of this, especially when you're coming to the hospital. We're going to ask you your last menstrual period. We are going to ask you your period length, that's how many days that you have your period for, and we are going to ask you your cycle length. So you cannot just be clueless. It's not nice that will ask you people these questions and you say you don't know. You can get a mini calendar in your house, or use your phone. Many of us have smartphones. You can use your normal calendar, or there are apps for tracking this thing, so you track it. And even if you cannot remember, because some people may not remember, we have a lot of things that we are thinking about, you can just say, okay, give me a moment, doctor, let me check my calendar, and you let us know, because these things are important. You always have to know these things or have them in your calendar. Track it. It is very important. Like, it even shows that you are caring for your body. It's part of self-care for you to know, because this is a very important, this is reproductive health. It's very important. If there's any change, it is by tracking it that you will know that there's something wrong. And it will also even help you predict when next your period will come. But I know that there are some people that have irregular periods and this may not work for them. But if your period is regular, you may want to track your period and make it easier for us when we ask you these questions in the hospital. I just wanted to throw that in. So let's go back into the matter. We're going to talk about common menstrual symptoms and how to manage them. First on our list is the cramps, or what we call dysmenorrhea, which is painful menstrual cramps. These cramps occur when the uterus contracts to shed its lining. So it's as a result of the uterus trying to force out the its lining that is trying to shed, and it may be mild or moderate. But if this becomes severe enough to prevent you from carrying out your daily activities, it is time to talk to a doctor. You are not to keep quiet about it. You are not to stay silent. Please speak with a doctor. It is not supposed to be so painful as you can no longer do your day-to-day activities. It is time for you to seek help. If you have mild to moderate, there are tips that can help you relieve it. You can try using a heating pad or what they call hot water bottle. There's something that is hot water bottle that they also use for postpartum moms. You put hot water inside, you make sure that it is tight so that you don't get burns. So and that's another matter. Make sure that it is tight, then you wrap it and put it on your lower abdomen. That can help to relieve the pain. Taking warm bath exercising may help, even as little as taking a walk. Why did I say little? It's not supposed to be little. Walking is not little. Walking is big. So little, so to speak, because some people see walking as like little exercise, but not so. So you can walk, try to be active and not just stay in one place. It will help to relieve the symptoms. And then taking pain relief like paracetamol can also help, but also speak with your doctor to prescribe one that is appropriate for you. Do not start taking NSAIDs or painkillers like that, like it is vitamin C, because you may have some conditions that may not allow you to take that, and you will not know if you do not consult a doctor. So also consult a doctor regarding painkillers. Stay hydrated, it will help you, and try to avoid caffeine also. It may also help to relieve the cramps. And then another symptom that we can have is bloating, and that is because of the hormone that is responsible for this period. It causes water retention. So what you can do to help with bloating is that you can limit your salty food intake, take more water, and also consider eating smaller portions of food more frequently than eating large portions of food. So just eat it like small. Eat like a veggie get. And then you can have mood swings and irritability. Hormones like estrogen, progesterone can affect mood and make you feel sadness, make you feel irritable. So it is these hormones, these changes with the hormones, the up and down of everything, and it makes you feel sad, it makes you cry a lot, makes you feel irritable. Yeah, it is the hormones that are responsible. So sometimes when you are feeling like the world is on top of your head and you want to give up, you may just want to check your calendar to see what time of the month it is. How can you help with this? Engage in activities that make you relax, like meditation, yoga, mild exercises, fun time with family and friends, dancing. Although it may not be easy because of the discomfort that comes with the period, but you can just try to practice some of these things. It will help to boost your mood and just have a way of making you feel better. And this brings me to mentioning PMS, which is the premenstrual syndrome, which is a group of physical and emotional symptoms like the bloating we've mentioned, mood swings, and other symptoms. So it is not a myth. It's not something that is Oyibo thing, so to speak. It happens. If this becomes excessive or extreme, it can even become as severe as premenstrual dysphoric disorder, which is the extreme form of PMS, and this even interferes with daily life and causes severe mood swings that you may not even be able to function like you normally do. So this is not a matter that you're supposed to shy away from. It is a very serious issue. Getting more sleep can also help to improve your mood. We also have breast tenderness as one of the symptoms. Many women experience this, and this is because of the fluctuations in the hormones. And this can be managed by wearing a supportive bra, reducing caffeine intake, taking over-the-counter pain medication can help to relieve the soreness. And we also have headache as a common symptom. Drinking lots of water, getting enough rest, managing stress can help with this headache. But if this headache becomes too severe enough to prevent you from carrying out your day-to-day activities, you already know what you should do. Consult your doctor. It is also important to know that each person's body is different, so some people may not even experience any of this, and some people will experience all of this and even more. So it is not in your place to judge somebody and say that, okay, when I'm on my period, I can raise a car, I can do this, I can go to the farm, I can save the world. Why are you just sitting down, lying down? Why are you throwing up? Why are you stooling? You are not to say that. You are not the same. We are different people. This period can cause really severe symptoms in some people, so you have to be sensitive. That is why this video is here, for awareness, to know that when people say that their period makes them to not be able to function, it is true. It can be that severe. So if your period is that severe that you cannot function normally anymore, it's time for you to see a doctor. It's time for you to speak with your doctor to discuss this and find a solution. Now let's talk menstrual hygiene and products. This is essential for maintaining health and comfort during your period, so it is important that we talk about this. There are different menstrual products available and we'll just go over them. First is the common one that everybody knows, which is the pad. It is attached to the underwear and it is used to collect the menstrual flow, and it ranges from disposable pads to reusable pads. So there are options. There are the ones that you can dispose and the ones that you can wash and reuse. It's advisable that you wear this for not more than 8 hours and to change it regularly. Another menstrual product that we have is tampons. These are small plugs used to collect the menstrual flow. But something that you should know with tampons is that you should not wear it for more than 4 to 6 hours to reduce the risk of infection. There's a really severe infection that can happen if you wear a tampon for too long. Please don't even forget it there, because I've heard that some people forget it. Don't forget it there. It is very threatening to your life, to your health, if it stays too long, or if you even forget it there. Another menstrual product that we have is menstrual cups. It has been gathering grounds, it has been entering the market, it has been getting more popular. It's reusable, so you just collect the flow, you rinse it off, clean the cup and insert it again and use it. You can use it over and over again. We also have the period underwear, which can be used on the days that are very light or as a reinforcement to other menstrual products. So you can add it to the menstrual pads or the tampons on the menstrual cups as a reinforcement, or you can just use it on the light days. These are special panties that are made for period days. Whichever option you choose is up to you, but what you should know is that you have to wash your hands before and after handling menstrual products. So before you change, you wash your hands. After you change, you wash your hands. This is just proper hygiene. And remember that changing these products often help you reduce your risk for infection, especially with the tampons. Not only tampons, others, but especially with the tampons. So when you see your doctor about menstrual health, when is the time to say, doctor, I have a complaint about my menstrual health? It is normal for periods to vary, but some symptoms may indicate underlying health issues which you will need to talk to your doctor about. Here are signs that you need to see your doctor. If you have extremely heavy bleeding, if you see yourself changing fully soaked pads every hour or many times through the day, it's time to talk to your doctor. If it is if your period is lasting for more than 7 days, it's also time to speak with your doctor. If you have severe pain, mild to moderate pain is okay, but if your pain is very severe enough that you cannot function, you can no longer do what you do normally every day, it is also time to see your doctor, as it can be a sign of serious conditions like endometriosis, fibroids. So you have to speak with your doctor so that you can be checked to know if you have any of this. If you have irregular periods, if your period length is lesser than 21 days or longer than 35 days, it is time to talk to your doctor about it. If you also find yourself skipping periods without being pregnant, like it's not coming every month anymore, it stays like 2 months, 3 months, is not coming, it's also time for you to see your doctor to explore things that can be wrong, because it may be PCOS. And that is why I keep emphasizing that it is important to monitor your period to see if there is any deviation or any change, because this is a very important part of our overall health. We can't just keep overlooking it as if it is something small. It is something huge. It is part of reproductive health, and it is very, very important. If you have other symptoms like persistent headaches, extreme mood changes, or signs of an infection like a foul smell or an unusual discharge, it is also time to see your doctor. Please do not self-medicate, do not use concussions or whatever. If you notice anything abnormal, it is only right that you speak with your doctor. Remember that menstrual health is a part of your overall health, so there is no need to be ashamed about seeking help regarding it. It is part of your life, it is part of your general well-being and your health, so you don't have to be ashamed about it, you don't have to be shy about it. So let's address the myths and misconceptions about periods. First is that periods are dirty. This is wrong because menstruation is a natural and healthy process, and menstrual blood is not dirty. Second misconception is that you can't exercise on your period. That is very wrong. You can actually exercise on your period, and for some people, exercise helps to relieve their symptoms. Third misconception is that tampons can get lost in your body. That is wrong because it cannot get lost. It may only feel stuck, but it is not lost. It can always be removed if at any time it feels stuck. Fourth misconception is that if you have irregular periods, you cannot get pregnant. That is wrong, because although irregular periods make it harder to predict ovulation, pregnancy is still possible. Fifth misconception is that you shouldn't talk about periods. That is wrong because menstruation is a natural part of life and there is no reason for it to be a taboo. Talking openly helps people understand and take care of their health. So in conclusion, menstrual health is a vital part of understanding and caring for your body. So whether you are just starting your menstrual journey or you've been experiencing periods for years, taking care of yourself during each cycle is important. I hope this video has given you a clearer understanding of menstrual health and empowered you with tips for a healthier and more comfortable period experience. Thank you so much for watching. Thank you for staying with me up till this time. If you found this helpful, why not give it a thumbs up, leave a comment, share your experiences, and share this video to someone that you care about, because this is an awareness that has to be spread. Thank you once again. Stay well, stay healthy, stay safe, and I'll see you in my next one. Bye for now.